everybody, and welcome to day 3 of the 5 days of feeling fantastic. We are here live in the Menopause Sisterhood. You may be watching me on YouTube. Welcome everybody. I just want to do our standard quality sound check to make sure that you can all hear me. Yes, I think you can. So if you were just joining me now, we are on day 3. You can go back and see day 1 and day 2 in the Menopause Sisterhood Facebook group. And if you have registered and are getting the daily emails, you can go and check in the YouTube links that you have received for the prior day's sessions. But today is day 3, and we are going to be discussing something that many women experience, but actually often they don't even realize that what they are going through can be possibly perimenopause related. So, how many of you women not only may or may not be gaining weight, but are experiencing many other digestive changes? Food doesn't feel the same in your body the way that it used to. And that's what we're going to be talking about today. As always, I will be explaining the phenomenon and what is going on. We will talk about why it's happening, strategies that you can do to help you navigate, mitigate, manage these symptoms, and some gentle yoga practice. In day 1 and day 2, we have done very active moving yoga practices as part of our strategies to help us manage with the symptoms we talked about in those days. Today, we're bringing it all the way down, and we are going to be doing a much calmer, much more relaxing yoga practice as part of the strategies that we can use to help us manage and treat the problems of bloated and digestive issues. So I'm just going to get my block to help me as I sit here and talk to you a little bit about explaining a little bit about this specific menopause symptom, what is going on in your body, why it's happening, and what we can do about it. So, first things first. We are specifically talking about today feelings of feeling bloated, feeling very heavy. Sometimes we have extra cramping, digestive uncomfortableness, passing gas more frequently, constipation, food that just doesn't respond in the same way, maybe feeling extra tired after you eat something. Just beginning to notice how your body is responding to different foods, especially the feeling bloated. And we really want to not have those experiences. Eat the foods that fill us up, that nourish us, that don't give us that extra digestive cramping, bloatedness, constipation. Gas is sometimes a very big issue. So what is going on? Why is this happening? And obviously, what can we do about it? So the first thing to say is that, as with everything in perimenopause and menopause, what worked before may not necessarily work for you now. That means food that you used to eat in your 20s and 30s that didn't make any difference to the way you feel now may make you feel bloated, more tired, more gassy, constipation, stomach cramps. And the key trigger foods that start to respond and react differently in your digestive system are gluten, sugars, dairy, alcohol, caffeine. Those are the key ones. There may be other ones, but those are the key ones. I will tell you very specifically, for me, my personal experience, one of the reasons why I began to really get so super interested in this whole field of menopausal women's health was because I spent a year suffering from bloated and stomach cramps. Every weekend I would just really look like I was pregnant, have really, really bad stomach cramps. And I didn't know what was going on. I didn't know why. I didn't know what had changed. I didn't know what to do about it. And eventually, through my work in the field, through my trainings, through my own research, and through talking it through with a nutritionist, I realized that my body had started to become intolerant of or sensitive to gluten. And I had never had a gluten problem before. And therefore I cut out all carbohydrates and all gluten sources. And I also really cut down on my sugar content. And within a couple of weeks, I had much more energy. My bloatedness had pretty much disappeared, and I wasn't suffering the stomach cramps anymore in the evenings. And that really was, me experimenting on myself, but I have seen this time and time again. Dairy over the last 9 months to a year for me has started to create problems for me. I can't eat dairy in the same way. My body doesn't respond to dairy in the same way. I also have started getting very much stomach cramps, feeling very gassy after I eat dairy. This is something that was never a problem before. I've never had sensitivities before, but because I know how to pay attention, to listen to my body, to notice these changes, I realized what the correlation and what the relationship was. So I've now really reduced the type of dairy I have. It's a specific type of dairy, but that I have now changed. Alcohol, I'm finding that alcohol I'm responding to in a very different way. My body can't tolerate alcohol anymore in the same way that it used to. This is my personal story, my personal journey that I'm sharing with you. But again, I see it time and time again with my clients. Sugar is one of the biggest things that impact your body in terms of energy, feeling tired, feeling fatigued. I have women who have cut out sugar and who have energy levels back to levels that they never thought was possible at this stage of life. They just thought, that's what happens. I'm a busy working woman. I've got kids. I'm running around. I'm doing all different things. I'm going to feel tired and lethargic. But all of a sudden, they change something in the food that they are eating and they feel totally different. So this is not anything that is, blanket statements. Everyone needs to cut out gluten. Everyone needs to cut out dairy. Everyone needs to cut out carbs. It's very much about what your personal symptoms are, what is going on with your lifestyle, and how you are feeling. This worked for me, and I know how to help you identify the areas that may be triggering for you. But we start off with the symptoms. What are you experiencing? What can we begin to cut out? What can we begin to identify as possible triggers for your bloated, cramping, digestive issues? And how can we start to navigate and identify? And then what can we add into your diet to help support you? Because it's not just about taking foods away. It's about what does your body need to feel nourished at this stage of life that maybe you didn't have in your diet, and what can we add and increase in your diet that can be supportive. So all of those things start to come into the conversation when we start talking about bloatedness, cramping, not feeling comfortable, constipation. Sometimes women have more diarrhea, it's not only constipation, but changes in bowel movements, changes in the way that you feel in general in your stomach. Now, another thing that is really critical to mention at this stage is that more and more research is coming out to identify how gut health is so critical to our overall health and well-being, how nearly 80% of our immune system sits in the gut, and the gut-brain relationship. Now, there was always the understanding and awareness in medicine, in the medical field, that our brain communicated with our gut. For example, through hormones like leptin and ghrelin, the hunger hormones, the satiated hormones, our brain triggers feeling sensations, emotions, our gut responds, and we feel hungry, we feel full, we feel nervous and anxious. So, we eat or don't eat, but that connection of our brain having a feeling or a sensation or an emotion triggering our gut. But what has actually become much more apparent is the reverse relationship, how the gut communicates with the brain. Through the vagus nerve, which we won't talk about today, that is our vagus nerve with our parasympathetic nervous system, but through the immune system, through our gut health and gut biology and our gut microbiome, it is actually communicating in the reverse way with our brain much, much more, which means what we eat, when we eat, and how we eat impacts our brain function, which is super important during menopause, perimenopause, when we are experiencing brain fog, cognitive changes, short-term memory loss, not being able to focus and concentrate, feeling low brain activity in terms of our ability to show up for things like work, fulfill our to-do list. We can support or hinder brain function by what is going on in the gut. So what we're eating, our gut health, all the stuff that's happening in our stomach is not only impacting directly the way we feel through feeling bloated, through stomach cramps, constipation, diarrhea, all the different gut issues and gut changes, but our gut health is also reinforcing potentially or impacting our brain and cognitive function, and also impacting our immune system, because what we eat, when we eat, how we eat, it has a direct impact on our immune system, because as I said, 80% of our body's immune system sits in the gut. So all of this is connected. It's difficult to sort of peel the layers apart and to sort of talk about it in isolation. But all these things are connected, and we definitely want to think about how our gut feels, how our digestive system feels by looking at what we're eating. And as I said, the key triggers at this stage of life are gluten, sugars, some carbs, some carbohydrates, especially the most simple carbs. And then next on the list, the dairy, the alcohol, the caffeine, and supporting our system. Supporting our system means taking supplements such as magnesium, such as zinc, increasing our fiber content, all those types of things. But there are also things that we can do to help manage our digestive system in the supplements that we take, not only the magnesium and zinc, but other things that we can use for our digestive system to help our digestive system. Things like peppermint tea, cumin, coriander. Cumin is excellent for supporting the immune system. We want curcumin or turmeric. Those are ginger. Those are the herbs and spices that are really supportive for the immune system, which we want to help support because, as we know, it's housed in our gut. So poor gut health is going to impact our immune system. So curcumin, coriander, fennel, aniseed, peppermint tea or peppermint oil, chamomile tea. All those things are really, really good for supporting our digestive system, which is what we want when we are experiencing these changes, but it may not be enough. Cutting out those food groups, the trigger food groups for you, identifying the trigger food groups for you, super, super important also. You can't keep eating the trigger food groups and take the supplements. It just doesn't work. Obviously, you can take probiotics, prebiotics. All of those things are digestive system supportive, but you can't keep eating the trigger foods and think that by taking the supplements that is going to work. You have to remove the trigger foods, let your system calm down, support the system support the digestive system with those extra supplements, and then see how your body responds. But it may be that these trigger foods for now at this stage of life are not great. So those are the natural supplements, the natural way to support yourself, removing the trigger foods, boosting the digestive system with all the supportive, nourishing stuff. Adding into our diet lots of healthy vegetables, lots of fiber, some seeds and nuts. The seeds are really, really great at helping our system to nourish itself. Pumpkin seeds, sesame seeds, sunflower seeds, all those seeds. Brain fog, so I have lost the other thing that I wanted to say. Flax seeds, chia seeds, or chia seeds, all those things are really good and supportive and nourishing for the digestive system. So we want to also add those in to your diet. Any comments? Put them in. Thank you for all the comments that are coming in now. If you have questions about specific food groups or specific supplements or specific ways to eat, when to eat, how to eat, what to eat, that is sort of all the things that I talk about in my program when I work with women, really breaking down not only what you're eating, but how you're eating and when you are eating. Those are also critical things that we really break down. I really break down with my clients and really start to identify, especially if you are really experiencing that bloated feeling, which a lot of women do. It's not only the weight gain, there are lots of other digestive things that are going on. And obviously we have some practical ways, which we're going to talk about now, using yoga-based tools and techniques, doing some stomach massaging, helping you when you have those cramps, and what you can do about it. One thing I want to add before we move on is drinking plenty of water. Always drinking. You can drink other beverages. It all counts. Any forms of tea, any forms of coffee, again, depending on whether you're cutting out the caffeine or not cutting out the caffeine. Obviously, water is always the best thing to drink. So keeping yourself hydrated always is going to be super, super important. So the yoga-based tools that we are going to be doing today includes, as I said, some stomach massaging, gentle movement, and also some breath work. But really, we're going to be doing, the stuff we're going to be doing today is all calm, lying down stuff. So get yourself on a mat, get yourself on the floor, get yourself in bed if you want, any nice flat surface. Today we are going to be lying down. So get yourself into position. I will get myself into position and we can start with some short practices. You can use pillows if you want. You can support your head. Anything that you would like that, you can with pleasure do that. Okay, so everyone can just lie down for a moment, take a couple of breaths. Okay, just get yourself into your position. I'm going to turn off my fan so that that isn't bothering us. And just lie however you feel comfortable, knees up. We can begin with knees up. You don't need a pillow. Only take a pillow if you want. I'm just going to have the pillow here so that I can keep seeing you all. You can rest your legs out, or you can have them bent. If they are bent, they should be hip widths apart. They should not be close together. They should be hip widths apart. Actually, I'm going to just put myself on an angle so you can see me a little bit better. Okay, there we go, that's nice. And we're just going to breathe. We want to breathe through the lungs, doing deep, deep lung breath. We want to get that diaphragm moving down on the inhale and up on the exhale. So deep breath work through the lungs, deep inhale, and then deep exhale. And as you exhale, feel the stomach being pulled in, feel the diaphragm being pulled up, feel the contraction of the ribs of the lungs as the air leaves your body. And then as you inhale, everything expands and grows. We want that diaphragm to be moving. We want the diaphragm to be coming down on the inhale and coming up on the exhale, and to really have that natural massaging of the digestive system through the work of the diaphragm. If you can identify your pelvic floor muscles, we can also combine pelvic floor muscle work with our exhale. So a couple of breaths. Deep inhale and exhale. You should slowly, as you're breathing, notice how your breath is getting longer, slower, deeper, how you are finding space between the inhale and the exhale, how you really are feeling the lungs moving as you inhale. Then as you exhale, if you can engage pelvic floor muscles, feel those core muscles, the transverse muscles, feel all the muscles coming up, including the diaphragm, pushing that air out of the lungs as you exhale. And just breathe for a couple more times, really getting that diaphragm to move. Getting good blood flow, good space in that digestive system. Okay. The other thing we can do is open up your legs, push them a little bit more away from your body. It can still be bent, but we want to create a little bit more room here. And we want to do just some very gentle abdominal massaging. So you start round on the bottom right, where your right pelvic bone is. Come up in a round circular motion, down from the left pelvic bone down, and gently across. Lift up the hand. Start there from the right pelvic bone all the way up, all the way around, down in a clockwise motion. So this is just gentle, basic abdominal massaging, just to help stimulate the digestive system, get some blood flow moving, get things sort of working in the digestive system. You can push down as much as you want. And then we're going to do the same thing, but we're going to now open up our knees. So our knees are open in butterfly pose. The soles of our feet are together. Okay. You don't need to add another pillow. I'm just adding it so you can see me. You can stay flat on the ground. We want to open up now the digestive system. Feel that openness through the digestive system, through the hips, through the legs, and you can again massage with a little bit more space there. Lifting, starting at the right pelvic bone, coming all the way up, all the way around, down at the left pelvic bone, and all the way around. So you can do that as much as you want. The other thing we can do is we just want to sit open. You can actually, if you would like, put some support underneath your chest. So a pillow, or if you have access to a bolster or some blankets rolled up. We want to create a little bit of height underneath our chest, and then we can lie down. Your head can be a bit lower, as long as you don't feel dizzy, but we want to open up the chest, we want to open up the digestive system. So we're sitting again in butterfly pose, soles of the feet are together, with our chest a bit more open, with our digestive system a bit more open, putting that support under our back, and to really open it up and again to breathe, to give it space, to give this whole area some openness, some space. We're going to do some deep breathing again. Inhale. Exhale. and really feel this area opening up to the breath. Very often our stomach cramps, our digestive issues is because there's not enough space, not enough room in the digestive tract, in that digestive area, to give space for the food, to give space for blood flow, to give space for movement. Often we are sitting for many, many hours. We're sitting hunched over a computer. We need to open up and get space. So you're carrying on breathing as you're open, as your digestive system is now getting some good blood flow, some good movement. Some deep breath work. Feel the air coming into the stomach, and then as you exhale, those pelvic floor muscles can be engaged, those transverse muscles can be engaged, pulling up the diaphragm. And you can stay here for as long as you want. So those are the first things that you can do. Other things you can do, also with the intention of massaging the stomach area, is bring your right knee and then your left knee up to your stomach. Inhale, and when you exhale, bring the knees up to the chest. It may feel a bit uncomfortable. If you're very severely bloated, that may feel a bit uncomfortable. So just do it to whatever level you can. Inhale, knees are out. Exhale, drop the shoulders and bring the knees in. And then release on the inhale. Exhale, bring both knees in on the exhale. If it's too intense doing it with both knees up, you can put feet down and then just bring one knee up. Inhale, and then as you exhale, bring the knee closer. Do it a couple of times and then you can switch. Right foot will be on the mat and you bring the left knee. Inhale, and as you exhale, bring the knee closer. And this helps, this squeezing of the knee towards the chest, and then the release helps to massage, squeeze that digestive system, open it up, and let all the blood flow rapidly flow into the system to nourish it and to help it just function better. So we have breath work, we have opened our digestive system, we have massaged our digestive system, and we have also massaged it with some knee work, either one or two knees coming up on the exhale. There's one other pose I would like to show you, and that is a cobra pose, where we are going to be we did this yesterday, I think, where we actually going to want to lie flat. Okay, again, if you really are bloated or have stomach cramps, it's maybe a bit uncomfortable, but we want the digestive system, the stomach, to be supported by the ground. We want to inhale, and as we exhale, we want to lift up. As you lift up, again, how high you lift, how high you lift will depend on your lower back. There should be no dropping of the pelvis, no feeling any pain or strain in the lower back. So you want to start off down, just feel the stomach being supported. Inhale and come up. Open up the chest. Feel the opening of the digestive system. Deep inhale, shoulders are down. Inhale, exhale, and gently come down. Inhale, come up. Inhale, exhale. And gently come down. If your stomach is super sensitive and that is too intense for you, you can take a pillow or some other soft support and put it beneath you. Again, inhale, coming up as high or as low as your lower back allows. No pain in the lower back, and come down. And one more time. Inhale as you come up. Exhale. Inhale. And after a couple of breaths, gently come down. And then rest it out, if you would like, in child's pose. And gently come up. So, I hope that all those different things that we've spoken about have been super helpful. Obviously, feel free to get in touch with me if you want more personalized guidance and support. If you want more information, you can reach out to me and we will start our journey together to figuring out how you can navigate and manage your menopause symptoms. But today was all about those digestive changes, and we covered a number of ways that you can help manage: eliminating food, adding the right food, having the right supplementation, nourishing your body, the importance of why this may be impacting you in many ways, not just feeling bloated and having cramps, and the different yoga-based techniques that you can do. So that was a lot today. Let me know, put it in the comments, let me know how you're going, let me know what you're implementing now into your life. And also, one last thing before I go, tonight I have a Q&A session happening right here in the Menopause Sisterhood Facebook group for you to ask any questions about anything that we have talked about so far, and I will share some extra tips, tricks, and information. So let me have your questions. Either put them in the comments or DM me and we will talk about them tonight. Have a great day, and I will see you tomorrow for day 4 of 5 days of feeling fantastic.